Muhammad Abu Bakr, and he is the section head, Drug and Medical Product Regulation of the
Good afternoon. Thank you very much for inviting me to this conference. It's the first time for me to attend a telemedicine conference, and I'm learning in every session or lecture a lot. I don't have a presentation, but our agenda asked me to speak about what's happening in Abu Dhabi, so that people have an idea of what's happening in UAE in general. Within the last 3 years, the government in Abu Dhabi mandated health insurance to all the people who reside in Abu Dhabi or in United Arab Emirates. And that created big access to care in the country, where people did not have, or those who did not have access to care, now they have access to care. The second thing that happened after that, the health authority put together a strategy for e-health in the Emirates. And this mandated that all healthcare providers and payers do all their transactions electronically in the country. And it also mandated the coding of the diseases, the coding of the medicine, the coding of the procedures to be with every encounters that the patient, whenever the patient see the physicians. So we went from an era where we didn't have any type of meaningful healthcare data to now where we have an abundance of data, because every encounter is being captured by the health authority, and all the payers also have data. They previously had this data, but now the data is standardized because we put standard of how the data has to be, the transaction of the data, how it has to be communicated between these different players. So, in addition, the health authority have developed what we call it a wiqaya program. And wiqaya program is because the leading cause of death in UAE is diabetes and cardiovascular disease. That's the #1 leading cause of death. So they put together a screening program for all the people every 3 years, that they have to measure certain parameter that describe or target cardiovascular risk. And the data that the people get when you do the screening, the health authority signed recently in June an agreement with our telecommunication company, which is Etisalat, to send this data to the patients. So every patient who does the screening will get his data. Currently the data is available on the website, and it is mailed to the patient at his home with green, yellow, red picture to tell him whether his numbers, if he is at higher risk or low risk, or he is at no risk. And in June, they signed an agreement with the telecommunication company to make this as a part of the M-Health or mobile health or e-health strategy, so people can get this information on their mobile, not only because there's a huge use of mobile technology in UAE. And so that's happening. Broadband, we have internet and 3G that cover 99% of the country. So that is enough to enable any type of telehealth or e-health or mobile technology to be really done in the country, but we don't see until now many applications happening. You know, we always think that the healthcare industry is behind other industry in adopting technology and especially electronic technology. In our hospitals, in the public hospitals, for at least the last 3 to 4 years, most of them have electronic health record. And the one in Abu Dhabi is specifically is the Cerner Millennium software that they adopted. And many of the private hospitals also have electronic health record, but we do not see electronic health records in the clinics and the smaller primary healthcare areas. That's why, when people want to adopt or want to implement, say, a clinical guideline through electronic or clinical means, it could be done in hospital level, but it cannot be done at remote areas or clinics because they do not, some of them do not even have computers. The physicians are not, they did not adopt the EHR because they have to pay out of their pocket. Whereas the government hospital and the big hospital, they can afford to have their own EHR systems. In pharmacies, we have actually mandated that all pharmacies have to have internet and have to have computers, and for the past 5 years. And recently we implemented, actually in September 2011, the pharmacy benefit management initiatives. And because we had extremely, with everybody insured, over-utilization of medication, and the only way to capture this on real-time basis was to implement this real-time transaction, so we can tell if the patient went yesterday to a doctor, because with the analysis we see patients going to doctors 15 times a month and getting very similar medication. So there was a huge abuse of the system. So one of the value of electronic record and electronic transaction and electronic authorization, it actually reduces the cost. So I think, reflecting on the studies, it depends where the studies is done, whether it would show whether it is cost effective or not. Because in the picture that you showed in Iraq with this baby being held externally, I don't know how you can put a value on the cost of helping this child. But definitely it is relative and sometimes subjective, and we cannot calculate and measure it accurately in every instance. But definitely if countries are spending millions of dollars in technology, it has to be assessed for cost efficiency. We see physicians in the hospital on personal level using the iPads to explain diseases for the patients. Cardiologists showing the patient, why did he develop heart attack, what's narrowing mean, what's arrhythmia, etc. But it's not widely accepted, but it's definitely, it's not widely practiced, but those who are the physicians that are technical in nature, or the young physicians, or young medical graduates are more adapted to the technology than other people. We have used teleconferencing, videos at this time only for medical education. So if there is seminars from abroad, this video conferencing is available, but we do not see any consultation happening using video conferencing. And one of the bottleneck is the regulation, because the physicians, there is no regulation. And actually, if you speak to the legal department, they tell you, well, you cannot do it because there's no regulation to govern that. So it's definitely very important to have policies to at least protect the physicians who are seeking second opinion in place to drive this to happen, because of the, as everybody said, the shortage, the problem health authority adapt also social media. You can see them on Facebook, on Twitter in the Middle East has not catched up very rapidly. Nobody actually, I mean, to tell somebody to tweet is really a foreign word. So it's not something that is common to the people. But Facebook, you know, the revolution in Egypt happened because of the Facebook. So everybody is familiar with the Facebook, but not Twitter. So it is, you know, slowly being adopted, but not as much as we see it in the West. We see now many pharmaceutical companies and insurance companies who are trying to develop programs for awareness and education, where there is a diabetes bus by Novartis, and they are providing the blood glucose meter that automatically send the message to the BlackBerry, and the people would get their blood sugar monitored, etc. We see this is happening, and the insurance companies actually have disease management program that they run by telehealth, where they have a group of people in the insurance companies that call diabetic patient as part of their disease management program to educate them, to encourage them to walk, etc. And also providing them with blood glucose meter that is electronic in nature and that can submit via Wi-Fi application the data to the internet, where they can view it themselves as a patient, or the physician or their physician can view it for further guidance. But we do not have a pacemaker or patients who have arrhythmias being monitored by telehealth yet. So this is just there's a lot to learn actually from what I see here in this conference, from the different initiatives that's happening. I feel that we have at least some type of infrastructure, and there is a strategy for e-health, but we don't have many applications being implemented yet in the country. But I agree that those that need to be implemented need to be studied for their cost effectiveness and their need in the country. Thank you very much.
Gareth, thank you so much, and I think what you just went out to, this is a wonderful platform to share our experiences and learn how to translate that into our own countries.
Yes.
So I appreciate your presentation. I have the honor of presenting you with a small token